My name is Nicole, and I'm here with another question drill set. If you are new here and don't know what a question drill set works, well, welcome. Hello, hello. Hello to all the new followers that we have because we just reached our 75,000 subscribers, which is great. Wonderful. But how a question drill set works is I pull up a question right here and I'm here with another give you about 30 seconds to look over it, figure out what the answer is, and drop your answers down in the chat. Then I go over why the right answers are right and the wrong answers are wrong, and then we figure out how we get to those right answers using maybe the keywords in the question, trying to figure out is it a positively worded question, negatively worded question, and I give you a couple of tips and tricks to figure out when you're looking at the questions and how to, the exam strategies basically of how to go about these NCLEX style questions. So that is great. We're going over post-operative questions today. So a lot of client education and as well as things as expected findings versus complications and other key things that you want to be looking out for post-operatively. We have Nurse Samantha in the chat moderating for me today. So if you have any questions or need reiteration or just want to give a shout out, she's in there to talk to you. And I have it pulled up here as well. So hello everyone tuning in from Michigan, and hello Anjupat Patel, and just lots of people. And good evening as well. Someone says good evening. So depending where you are in the whole world, hello, good morning, good night, whatever. So let's get started with today's question drill on post-operative things. The first question, the nurse is caring for a client with a chest tube attached to a closed chest drainage system. Which of the following findings would be a priority to follow up? Option 1, intermittent bubbling observed in the water seal chamber. Option 2, crepitus around the insertion site. Option 3, serous drainage observed in the collection chamber. And option 4, clamp drainage tubing. Let me know what you guys think in the chat, and we'll go from there. And like I said before, we hit 75,000 followers on our social media, but you can always continue to keep sharing, liking it, showing it to all your nursing school friends, fellow classmates. Share it to everyone on all social media platforms, Instagram. I was about to say Netflix. No, not Netflix. That's what I want to be watching right now. Instagram, Facebook, TikTok, YouTube, any of your social media platforms. Share it, like, subscribe, all the typical things. Lots of good answer choices. It's pretty unanimous already. We're starting off strong. And the correct answer is option 4, clamp drainage tubing. We are always looking out, and this is a very high priority to always look out for a clamp drainage tubing on a chest tube or a closed chest drainage system. A closed chest drainage system is the high intellectual wording for a chest tube, which is a connection that we use to help re-expand the lung or pleural space, drain any fluid, any blood, anything that is making that pleural space and that lung collapse to help re-expand it so you have your full lung capacity. So that clamp drainage tubing, that is defeating the whole process of that negative pressure being pulled out and to help re-expand that lung. So if we're defeating the whole purpose of the whole mechanism of the chest tube, then it's not working in our favor. So we're always assessing for clamped drainage tubing or clamp tubing. Always follow the line all the way up to the client, even if it's not like the full-on hard clamp. There's sometimes even those pigtails which would also be considered clamping the tubing. So always look at the pigtails, that kind of like the stopcock that can cut off the airflow of the negative pressure. So watch the tubing and look at it all the way from the patient down to the actual chest tube. Options 1, 2, and 3 are expected findings of a chest tube. Intermittent bubbling observed in the water seal chamber. This is expected, especially with breathing or coughing. As long as it's intermittent, it is okay. If we see continuous tidling or continuous bubbling, that would be indicative of an air leak. And so again, we would follow the line to make sure everything is connected, make sure it's not dislodged actually from the patient, and everything is connected to the chest tube. Option 2, crepitus around the insertion site. Again, an expected finding. As long as it stays around the insertion site, we have a foreign object in our body. You're going to feel a little bit of crepitus, which is that, someone said, Rice Krispie feeling around the insertion site because of that foreign object. As long as it stays there and doesn't start spreading to the upper chest or the back or the shoulder, then it's okay. When it starts spreading, then we start thinking of subcutaneous emphysema, which is a complication and another problem. So around the insertion site is okay. And then option 3, serous drainage observed in the collection chamber, expected, and that's what we want to see. If we're draining fluid or draining anything, we want it to be collected in the collection chamber. So that's okay. Good job. Question number 2, the nurse is observing a staff member caring for a client with an arterial line in the right upper extremity. The nurse should intervene if the staff member is observed doing what? Option 1, inserting a peripheral venous access device in the left upper extremity. Option 2, zeroing the transducer at the level of the phlebistostatic axis. Option 3, monitoring the insertion site for warmth and erythema. And option 4, administering analgesics through the arterial line. Let me know what you guys think in the chat. Drop your answers, and we'll go from there. Good job, good job. Y'all guys did great on that last one. What about this one? Also, let me know if we have any recent NCLEX passers or if you're scheduled to take your test in the next couple of weeks or months. I'd love to give you a shout out, get those endorphins going. Let me know in the chat. Good job, guys. We have Alexa on TikTok taking her NCLEX tomorrow. Good luck. Wishing you the best of luck. You're doing great. You're going to do great. And since you're tuning in right now, getting that last study sesh, you're going to do fantastic. Cindy on TikTok takes hers in 2 weeks. Who else? Wybor on TikTok takes theirs next Wednesday. Good luck to you. Someone is scheduled for August 8th. Good luck to you. Couple more people in 2 weeks, like literally 3 different people in a row taking theirs in 2 weeks. Good luck to you, end of July test takers. Good luck, good luck, good luck. Wish you the best of luck. You got this. You know the information. You're studying well. You're tuning into us. It's all the good juju going on. Okay. Lots of good answers as well. Correct answer for this one is option 4. You guys got this easy peasy as well. An arterial line. So going back to the question, the nurse should intervene if the staff member is observed. So intervene. It's a negatively worded and question, meaning that we're looking for an incorrect option or incorrect intervention. So the only incorrect intervention out of these options is option 4, administering analgesics through the arterial line, which arterial line, this is an invasive way that we use to monitor blood pressure. We also use it to draw blood to do ABGs or lab values. But the main thing is we always take things out of the arterial line. We never administer anything, never administer anything into the arterial line. That is complete contraindication. So administering analgesics through the arterial line would be our incorrect intervention. Options 1, 2, and 3 are things that we would do for an arterial line. We would insert a peripheral venous access device in the left upper extremity. Since that art line is in the right upper extremity, we want all interventions to be on the opposite side. So in this case, an IV in the left upper extremity would be okay. Option 2, zeroing the transducer at the level of the phlebistostatic axis. This is the correct placement that we want the transducer at so we can get an accurate blood pressure reading. If the transducer is too high, then it would make a low blood pressure. If the transducer is too low, then it would make it high. It kind of works in the opposite way. So we need to make it sure it's at the correct level, which is at the same level as that right atrium with the correct pressures of the heart pumping. So we need to make sure it's at that phlebistostatic axis. And then option 3, monitoring the insertion site for warmth and erythema. Obviously, we have an invasive line, so we need to make sure that it doesn't have a hematoma or any complications at the actual insertion site. So again, monitoring is always a good idea. So correct answer again, which an incorrect intervention would be option 4. We did great. Next question. The nurse is caring for a client with closed wound drainage system, which would be like a JP drain or a bulb drainage. Which of the following actions should the nurse take? Select all that apply. Option 1, assess the insertion site daily. Option 2, strip the connection tubing once per shift. Option 3, document the color and consistency of the drainage. Option 4, secure the closed wound drainage system to the client's gown. And option 5, compress the bulb prior to attaching it to the connecting tubing. Let me know what you guys think in the chat. We have some more people putting their testing site August 6th at the end. Oh, someone passed at the end of May. Miss Dana on TikTok passed at the end of May. Congratulations. That is so awesome. And she starts her job on Monday. Welcome to the RN life. Welcome to the nitty gritty. No, it's fun over here. Someone passed on Valentine's Day. I just love that for you. No pun intended. Actually, yes, pun intended. Lots of good, correct answers. Good, correct answers. Look at these answer choices closely, though. Some might be trying to skew you a little bit wrong. Hint, hint. Maybe think of it, should I be doing this only? If I only did this, would that be enough? Trying to say it without giving you the answer. But think about these answer choices. If I only did this, if I only did blank, would that be enough for my documentation? Cough, cough. Good job. Some people are also putting in the chat what they're doing to study, which I love that. Help each other out. Someone is saying they're using the UWorld's question bank, which is questions like these over and over. I always say practice makes progress, and getting in the right practice of how to answer these NCLEX style questions is one of the best ways to study. Because if you're more confident answering the question and knowing how to answer these questions, then you'll be better at taking the test. Good job, guys. Good job, good job. Okay, so this question was a little bit tricky because the wording can throw some people off. So that's why I was trying to hint, but the correct answers would be options 3, 4, and 5. So we're looking for the following actions that the nurse should take. So positively worded. So we're looking for correct interventions. Excuse me. Option 3, document the color and consistency of the drainage. This is going to be correct. We're always going to document what we actually see and is coming out, especially for the provider later on, so they can assess whether it's ready to be pooled or if there's any complications with the drainage. Option 4, secure the closed wound drainage system to the client's gown. Again, another correct intervention, because we don't want that bulb drainage or drainage system to be freely dangling, because it can cause tension and pull at the actual insertion site and possibly dislodge. So we always want to attach it to something, the gown, the clothing, something. And then option 5, compress the bulb prior to attaching it to the connecting tubing. This is just how we ensure that negative pressure is being induced by compressing it and then attaching it, so that negative pressure is drawing it all the fluid or anything out and back into the bulb as it reinflates. If it was already inflated and you connect it, then it's not creating that negative pressure within the system. Option 1, I know a lot of you people chose option 1. The reason why option 1 is incorrect, and what I was trying to hint at, is if we only assess the insertion site daily, that might not be enough. Actually, I know for sure that's not enough. We need to at least do it every shift. Most likely you're going to be doing it way more, usually at least every 3 or 4 hours, just because complications can happen at any time, especially with movement, the client moving around. We want to have eyes on it way more frequently than just daily. Option 2, strip the connection tubing once per shift. Again, that stripping in general is not recommended because you can accidentally dislodge it from the client and cause more tension as well. So stripping the connection tubing is not recommended. So yes, that one was a little bit tricky. Threw some of you guys off with that option 1 with that daily, but we know that we should be assessing way more than daily. But pretty good job. Next question. The nurse is teaching a client who has a new prescription for patient-controlled analgesia, a PCA pump. Which of the following information should the nurse include? Option 1, pain will be eliminated while receiving PCA. Option 2, continuous IV fluids will be connected to the PCA tubing. Option 3, medication is delivered each time the delivery button is pressed. And then option 4, family members can push the delivery button while you are sleeping. So let me know what you guys think in the chat. This one should be a little bit more straightforward. Read each answer choice and make sure every element in that answer choice is true all the time. All the time? All the time. Hint, hint. Good job. Drop your answers. And what question are we on? Question 4. Yes, we're halfway through. So now I get to ask ask my favorite question, where you guys are tuning in from. Now that we have probably a good chunk of people on and watching, let me know how far youth world is reaching. Are we more international? Are we more domestic? Are we in the United States? Are we in Texas? Are we in, first one I see is Florida. We're in Florida today. We're in Houston. We're in Baton Rouge, Louisiana. Philadelphia, Italy. I love Italy. Jersey, Virginia, Texas, Illinois, LA, Trinidad, Massachusetts, San Antonio, Texas, Chicago, Vegas, baby, Vegas. Ohio, South Africa, Minnesota, Oklahoma, Massachusetts. This is when it starts going fast. Zambia, California, Connecticut, Japan. My eyes get cross-eyed. Toronto, Kenya, Florida, Ghana, Scotland, New York State, Kenya, Brazil, Omaha, Ghana, Palm Beach, SFO, San Francisco? Maybe not. Dubai. Someone said that they saw me in Seattle. Hello. I don't know who you are, but hi. Nice to see you again. Seattle was the huge NSNA conference, which, shameless plug, I'll put the shameless plug at the next question. But hello from Seattle, Pakistan, Philippines, Jamaica, Nigeria, New Jersey, watching live from Ghana. What time is it in Ghana? Shouldn't you be going to sleep soon? Alabama, Roll Tide. I'm not from Alabama, but Roll Tide. Okay, correct answer for this one is option 2, continuous IV fluids will be connected to the PCA pump. So with this question, we have to look very, very closely to make sure that every element in the answer choices is correct all the time. So option 2 is the only answer choice that is correct all the time with the whole answer choice. Continuous IV fluids will be connected to the PCA tubing. This is true because the PCA pump delivers a small amount of pain medication, and that small amount might not be able to actually even clear the entire tubing. So that continuous IV fluid is also there to help push that pain medication into the client. So it will always be connected to continuous IV fluid. Yes, it will probably be going at a slower rate, but it's ensuring that all that medication will be delivered to the client. Options 1, 3, and 4, there's usually some element that is not correct in it. So option 1, pain will be eliminated while receiving PCA. While this is our goal, it might not be completely true the entire time. Sometimes clients don't achieve complete no pain. Sometimes it just takes away majority of the pain. Sometimes when it's first initiated, it hasn't even kicked in just yet. So we can't say that pain will be eliminated the entire time. So that is why option 1 is incorrect. Option 3, medication is delivered each time the delivery button is pressed. Again, this isn't true every time. So the provider will the provider will do a protocol of how the PCA should be programmed. So usually it's a certain amount of medication with a certain amount of time, and then there's a lockout period. So if they push the button enough times to get them to the lockout period, so if they keep pushing the button 4 different times, but the lockout period is every 6 minutes, they're not going to be continuously getting that medication, even though they're pushing the button and that continuous IV fluid is going. So that lockout period prevents them from overdosing from those opioids or narcotic medication, and it's just a safety parameter as well. Then option 4, family members can push the delivery button while you are sleeping. Again, this is a no-go and a specific teaching point before you actually even initiate the PCA pump to make sure that the patient, which is why it's in the name, patient-controlled analgesia, is the only one that can control the button. So option 4 would be incorrect, but you guys did great. Next question. The nurse is teaching a client who had surgery 12 hours ago how to use an incentive spirometer. Which of the following information should the nurse include? Option 1, raise the head of the bed to 45 degrees before using the device. Option 2, use the incentive spirometer once per day for 1 week. Option 3, clench the teeth on the mouthpiece of the incentive spirometer. And option 4, inhale slowly to raise the piston to the goal marker. Let me know what you guys think in the chat. Remember, this is a positively worded question, so we're looking for a correct intervention or correct teaching point. And then read each answer choice very, very carefully to make sure that each element in the answer choice is correct all the time. Let me know what you guys think. It's definitely a tricky question, because I'm seeing lots of 4s, 2s, and 1. Read each answer choice separately. Try to see if that one sentence is correct all the time. Or is there variables to that answer choice? So it's 1/4. Let's see. We're looking for a correct teaching with an incentive spirometer. Now I'm seeing some 3s. And now I'm seeing some rationales. Miss Taylor Moore on TikTok, you are correct. You are correct. Someone is trying to point out 12 hours ago with the surgery. We don't know what type of surgery they had, but they did have a surgery. I don't think that's too relevant to this question, as long as they're getting this incentive spirometer at this point. Okay, we're still getting lots of 1s, 3s, and 4s. So I guess everyone's on the same playing field that 2 is incorrect, which is good. Good job. But the correct answer for this one would be yes, option 4. Inhale slowly to raise the piston to the goal marker. So if you read each answer choice independently to make sure that each element in this answer choice would be correct, this is the only one that would have correct every single time, no variable into it. So to use an incentive spirometer, yes, you inhale slowly to raise that piston to kind of inflate that lung and get that lung to its biggest capacity. And that's how you correctly use an incentive spirometer. I always remember incentive spirometer, you inhale. A lot of people kind of get confused and think that you actually blow into it. No, you don't blow into it. You inhale. Option 1, a lot of you guys chose option 1. This one was also tricky because you actually want them higher than 45. If at 45, that's okay, but you actually want them sitting straight up, or even standing would be best, to kind of help that lung re-expand. If they're sitting at 45, they're kind of having gravity working against them, so they're not having that full expansion of that lung that they should be having. So we actually recommend them sitting up at 90 degrees or actually standing up. So that is why option 1 kind of tricked you guys. Option 2, we all agree that this is incorrect. Use the incentive spirometer once per day for 1 week. We all agree that that is not enough for that lung re-expansion. You actually try to get them to have it at least 10 times every hour while they're awake, but definitely more than once per day for a week. That's basically nothing. And then option 3, clench the teeth on the mouthpiece of the incentive spirometer. That can actually, biting down on that mouthpiece can actually occlude the actual mouthpiece or the hose for the incentive spirometer. So you just put a tight seal with your lips, not with your teeth, around the mouthpiece. So good job, guys. Pretty good job. It was tricky. I will admit this question was a little bit tricky, but read each answer choice independently to make sure every element in it is correct all the time. Let's move on to question 6. The nurse is caring for a client who had a percutaneous coronary intervention via the right femoral artery 15 minutes ago. Which of the following actions should the nurse take? Select all that apply. Option 1, instruct the client to report changes in sensation to the right lower extremity. Option 2, inform the client that back pain is expected following the procedure. Option 3, monitor the client's right pedal pulse every 15 minutes. Option 4, initiate continuous cardiac monitoring for the client. And option 5, place the client in the high Fowler's position. Let me know what you guys think in the chat. Thank you guys for helping each other out with more rationales of why, especially on that last question, certain things were right and incorrect. Good job, y'all. Lots of good answer choices on this. Select all the apply. We're looking for basically, what are we going to be looking out after a right heart cath? Drop your answers. And while y'all are thinking about it, this is my shameless plug for 2 things, that we have lots and lots of times for you guys to tune into our free resources of these lives, whether we're having question drills, we're having lectures, concept maps. We have lots of free resources with our lives that you can see at uworldnursing.com on our event calendar to see what specific topic that we're covering throughout the next couple of weeks. But then also on Monday, we are hosting the NSNA webinar. We are doing another exam strategy, honing in on those SATA questions and prioritization questions that you guys also always ask for, as well as some obstetrics learning. I think we're doing lecture and some question drills with that. So tune in on Monday. You have to register to get the link and the ticket. And then we'll go live on Monday around 11 a.m., I believe. So see you guys then. Good job, good job. Yeah, you guys got this very easily. Options 1, 3, and 4 are the only correct interventions or teaching points for a right heart cath. We are going to instruct the client to report changes in that sensation to the right lower extremity. With that right heart cath, this is a procedure where they go in through a large artery, and in this case, it's the right femoral artery, to go and look at the heart, do any interventions, whether it's a stent or just doing diagnostic, to look into the heart and the different valves of the vessels and of the heart. So since we're going in through that large vessel of the right femoral, we need to make sure that circulation afterwards remains adequate. So that looks at distally, so those pedal pulses and the sensation of that right lower extremity, to make sure that the circulation remains adequate. Option 3, monitor the client's right pedal pulse, again making sure that circulation is working well. Option 4, initiate continuous cardiac monitoring. This is for a heart procedure in general. So putting them on a continuous cardiac monitor probably would have been done before, but we need to continue doing it afterwards since we went through a large vessel. Going to the heart could possibly cause more, maybe arrhythmias, PVCs. We need to be a lookout to prevent any further complications. Option 2 is incorrect, informing the client that back pain is expected following the procedure. This is actually a complication. If they're complaining of back pain, yes, they're on bed rest, which is option 5. Yes, they're on bed rest, but if they're complaining of serious back pain, that could be a complication of retroperitoneal bleeding, that blood pooling in the back of their kidneys, which is a complication of these heart caths. So that is not expected, and we want them to let us know, but not expected. Option 5, place the client in the high Fowler's position. This is the incorrect option and the opposite. We actually want them laying flat for a significant amount of time so we can get that adequate blood flow. We're not causing too much pressure on that femoral line in this case, or femoral access point, to not create a hematoma or any complications in that area. So option 5 is incorrect, but you guys did good on this one. Question 7, last question of the day. The nurse is caring for a client who had a modified radical mastectomy of the right breast 8 hours ago. Which of the following actions should the nurse take? Option 1, allow the client's closed wound drainage system to hang freely. Option 2, place a safety alert bracelet on the client's left upper extremity. Option 3, obtain blood specimen from the client's left upper extremity. Or option 4, encourage the client to sleep in the right lateral position. Let me know in the chat what you guys think. This one is testing your knowledge on post-op kind of positioning and interventions when you have a mastectomy. Someone asked, what is NSNA? NSNA is National Student Nurse Association. It's with the whole nation. It's kind of like our community here, but like the paid subscribe version. It's a cool version. And we actually go to their conferences in the fall and the spring to do lectures like this, but live and direct. We get to meet you guys. It's a really fun organization to be a part of. So join on the NSNA website or through our link at uworldnursing.com. If you can't find it on our page, go directly to the source of NSNA. I think it's .org. Google it. ChatGPT it. Just kidding. Okay, correct answer for this one, you guys got it pretty unanimously, is option 3, obtain blood specimen from the client's left upper extremity. So the main teaching point with mastectomies in general is whichever side the mastectomy is on, you want to do all the interventions on the opposite sides so we don't occlude or hinder any circulation that could help heal that site. So in this case, we had a right breast mastectomy, so you want all interventions for the most part to be on the left side. The only intervention that wouldn't be on the left side would be that safety alert bracelet, which is option 2. We actually want to put that on the same side as the intervention. So we want that on the right side, which is why option 2 would be incorrect. So that whenever someone is going to put an IV or blood pressure cuff on that affected side, they know, hey, that this side is a safety alert. I cannot go on this side. So that's the only thing that can be on the same side. Everything else, blood pressure, IVs, any intervention, movement, laying. So option 4, encourage the client to lie in the right lateral position. No, we actually want them on the opposite side so they don't have any occlusions, and we want to encourage that blood flow. Option 1, allow the client's closed wound drainage system to hang freely. This is just like a JP drain. You don't want it to hang freely. You want to clip it to the gown or their shirt or their clothing so it doesn't cause tension on that incision site and then accidentally dislodge. So option 3, you guys did pretty good. I know I had a lot of tricky questions in today's question drill, but you guys actually did very, very well, and I'm very proud of you guys. But if not, practice makes progress, and that's all that I can ask you guys for. So thank you guys so much for tuning in, and I will see you guys next week.